As a brain doctor, I've seen thousands of scans, strokes, and symptoms, but nothing shocked me more than this. A common vitamin, yes, a vitamin people take daily, can actually increase your risk of stroke overnight, especially if you're over 50. And yet, millions are still taking it, thinking it's helping them. Welcome to Everly Health, the trusted channel for seniors managing diabetes, blood pressure, brain health, and more. If you're over 50 and care about your future, this video could save your life because we're diving deep into a shocking discovery that connects one popular vitamin with higher stroke risk in older adults. Stick with us because in the next few minutes, you'll learn what this vitamin is, how it silently affects your brain's blood vessels, and most importantly, what to do instead. We don't use fear, just facts. So if you want clear, honest health advice for seniors, go ahead and subscribe now and tap the bell so you never miss life-saving updates. Number 1. Vitamin E in high doses. Vitamin E is often hailed as a powerful antioxidant, used in everything from skincare to heart supplements. But what most people, especially seniors, don't realize is that in high doses, vitamin E can increase the risk of stroke, particularly a type called hemorrhagic stroke, bleeding in the brain. The problem lies in how vitamin E works. While it does help protect cells from oxidative damage, it also acts as a blood thinner. In small amounts from food, that's not an issue, but when taken in high-dose supplement form, often 400 IU or more daily, it can reduce blood clotting too much, increasing the risk of internal bleeding, including in the brain. Multiple studies, including a large-scale review published in the British Medical Journal, have linked high-dose vitamin E supplements to a 22% higher risk of hemorrhagic stroke. That means for seniors, especially those already taking medications like aspirin, warfarin, or blood pressure meds, the added thinning effect can be dangerous, even deadly. Here's the twist. Many people over 50 take vitamin E thinking it will protect their heart or eyes, but they don't realize that they're stacking blood thinning effects without monitoring. And because vitamin E supplements are available over the counter, there's a false sense of safety, like it's just a vitamin. What makes this more alarming is that hemorrhagic strokes, although less common than ischemic strokes, are far more deadly. Bleeding in the brain can cause rapid pressure buildup, brain cell death, and long-term cognitive damage, if not fatal. And unlike clots, they can't be dissolved with meds like TPA. So how much is too much? The safe upper limit for vitamin E in supplement form is 400 IU per day, and many doctors now advise seniors to avoid supplements entirely unless there's a diagnosed deficiency. Most people get enough vitamin E from food, like nuts, seeds, and leafy greens, without needing extra pills. And for seniors with diabetes, high blood pressure, or a history of stroke, this warning is even more urgent. Your blood vessels are already under stress. Thinning your blood without supervision can push them past their limit, especially overnight, when blood pressure naturally fluctuates. Bottom line, more isn't always better. Taking vitamin E without medical guidance could be doing the opposite of what you intended, raising your risk of brain bleeds and stroke, not reducing it. Always talk to your doctor before taking any high-dose supplement. And if you're already taking vitamin E daily, it may be time to rethink it because healthy doesn't always mean safe. Number 2. Vitamin B6 in excess. Vitamin B6 is essential for brain health, nerve function, and energy metabolism. But here's the catch. When taken in high doses over time, especially through supplements, it can actually become toxic to your nervous system. For seniors, this means a greater risk of nerve damage, imbalance, and even stroke-like symptoms that may go unnoticed until it's too late. Many multivitamins and energy supplements contain megadoses of vitamin B6, sometimes over 100 milligrams per serving, far above the recommended daily amount for adults, which is just 1.52 milligrams. While a short burst of extra B6 isn't usually harmful, taking high doses daily for weeks or months can result in sensory nerve damage, which affects your balance, reflexes, and coordination. But what does this have to do with stroke? Here's what most people miss. When nerves in your arms, legs, and spine start misfiring due to B6 toxicity, your brain receives confused or delayed signals. Seniors often report symptoms like numbness, tingling, muscle weakness, or loss of balance, all of which are also early signs of mini strokes or transient ischemic attacks, TIAs. This overlap can delay diagnosis, putting you at higher risk of a full-blown stroke. Even worse, if you're already dealing with diabetic neuropathy, high-dose B6 can worsen the nerve damage you already have. That means more instability, higher fall risk, and poorer circulation, which can make it harder for your brain and body to recover in case a stroke does occur. There's also evidence that long-term B6 overload can interfere with how your body handles other B vitamins, like B12 and folate, which are critical for brain and vascular health. That imbalance can lead to elevated homocysteine levels, a dangerous compound in your blood that's been linked directly to higher stroke and heart disease risk. What's most concerning is that many people don't even realize how much B6 they're taking. It's in energy drinks, sleep aids, pre-workouts, and many brain-boosting supplements. Seniors trying to improve memory or reduce fatigue may be overloading their systems without knowing it. The good news, B6 from food like chickpeas, bananas, chicken, or fortified cereals is safe and helpful in normal amounts. The problem comes from supplements, especially when you're taking multiple products that all include B6. To protect your brain, check your supplement labels. If you're getting more than 50 milligrams daily without your doctor's supervision, it's time to reassess. Your nervous system thrives on balance, not excess, and too much of a good thing can quietly turn into a serious health risk. Number 3. Vitamin B12 deficiency. This might surprise you. It's not always too much of a vitamin that's dangerous. Sometimes it's a deficiency, and vitamin B12 is a perfect example. Low levels of B12, especially in seniors, can cause symptoms that mimic a stroke, memory loss, slurred speech, numbness, balance problems, and even confusion. Worse, B12 deficiency often goes undiagnosed for years. Vitamin B12 plays a critical role in maintaining myelin, the protective sheath around your nerves. Without enough B12, your nerves begin to break down, especially in the brain and spinal cord. This causes neurological symptoms that can be mistaken for mini strokes or early signs of dementia. In reality, it may just be a missing vitamin, but the damage can still be long-lasting. For seniors over 50, this risk is even greater. As we age, our bodies produce less stomach acid, which is necessary for absorbing B12 from food. Conditions like diabetes, acid reflux, or long-term use of metformin or proton pump inhibitors, PPIs, further block B12 absorption. That's why many older adults develop deficiency, even with a healthy diet. But there's a hidden link between B12 and stroke risk that most people don't know. Low B12 causes elevated homocysteine levels in the blood. Homocysteine is an amino acid, and when it builds up too much, it damages blood vessels and raises the risk of clots, heart attacks, and ischemic strokes. Even worse, early symptoms of B12 deficiency, like dizziness, mood swings, or tingling hands, are often dismissed as normal aging. But left unchecked, this deficiency can result in permanent neurological damage. That's why catching it early is essential for protecting both brain and heart health. One study published in Neurology found that seniors with low B12 levels had twice the risk of brain shrinkage and cognitive decline. Combine that with reduced balance and nerve signaling, and it's a recipe for falls, head injuries, and delayed stroke recovery, all of which can be devastating in older adults. The fix? Get tested. A simple blood test can reveal if your B12 levels are low. If they are, your doctor might recommend sublingual B12 under the tongue injections or a methylated supplement, especially if absorption is impaired. Don't guess, test. This is a reminder that stroke risk isn't always about what you're taking too much of. Sometimes it's about what your body is missing, silently weakening your defenses. Vitamin B12 is one of the most overlooked and most essential vitamins for long-term brain protection. Smart tip: don't just take vitamins, manage them smartly. Vitamins can be powerful allies or dangerous saboteurs depending on how you use them. The key isn't to fear supplements, but to take control of them with intention and awareness. Always check the dosage, the frequency, and whether you truly need a supplement based on your age, diet, and health condition. More isn't better. Balance is everything. If you're over 50, make it a habit to review your supplement list with your doctor or pharmacist at least twice a year. This simple routine can catch dangerous overlaps, like combining blood thinners with vitamin E, or unknowingly taking high doses of B6 from multiple sources. Also, don't skip routine blood work to check for hidden deficiencies like B12. What you don't know can hurt you. Finally, get your vitamins primarily from whole foods, nuts, leafy greens, fish, eggs, and fruits, not just pills. Food gives you the cofactors and fiber your body needs to absorb and use nutrients properly. And when supplements are needed, treat them with the same caution as medicine, because that's exactly what they are for your brain and heart. So now you know, some vitamins we trust every day could quietly be putting your brain at risk. But the power is in your hands. With the right knowledge, simple blood tests, and smart habits, you can protect your brain, your heart, and your future. If this video opened your eyes, don't forget to like, share, and subscribe to Everly Health. We're here to guide seniors like you with science-based tips to live longer, stronger, and smarter, one choice at a time.